Hello, everyone. I'd like to welcome you to our first session, The Financial Burden of Kidney Disease. Let's talk. My name is Daisy Escato, and I am the Kidney Care Manager of the Northern Alberta and the Territories branch based in Edmonton. The format of this session is conversational, like a fireside chat, and we'll be taking questions and comments throughout the session. For confidentiality, and so our moderators don't miss questions, please don't post them in the chat. Instead, please submit questions and comments through the Q&A box located below this video panel. We'll be discussing aspects of the financial burden for kidney patients, but please note that we are unable to go into detail about specific programs and services in this session because most programs are provincial and there are differences in services from province to province. I would now like to introduce our moderator for this session, Joe. Joe's kidneys failed for the first time over 15 years ago when he was officially diagnosed with systemic lupus erythematosus, also known as SLE. He has lived with varying stages of chronic kidney disease and end-stage renal disease ever since. Joe has experience with in-center hemodialysis and peritoneal dialysis, both APD and CAPD. Currently, he is having his treatments at his hospital via Nocturnal. He is a bit of a couch surfer and travels a lot within Southern Ontario for work and for leisure. He works part-time as a self-employed technical consultant. He is studying towards a degree in the life sciences and volunteers as a peer supporter and group facilitator with the Kidney Foundation, and is, of course, a full-time patient too. Thank you, Joe.
Thanks, Daisy. I appreciate the introduction. And now it's to be my pleasure to introduce our starting session today. And so we have two speakers with us. Both of them are social workers, and I'll introduce them now. First is Corinne McNabb. Corinne has been with the Regional Kidney Care Program of Simcoe Muskoka in Orillia since 1999. She's also the Clinical Palliative Care Champion for the Ontario Renal Network, the ORN, and is currently the president of the Canadian Association of Nephrology Social Workers, or CANSWA. And we're also lucky to have Nanette Durand with us today. Nanette has been supporting patients as a social worker for over 25 years, primarily in the fields of healthcare and domestic violence. In addition to working with the Alberta Health Services in the renal program, she also works as a group facilitator with YWCA Calgary. And Nanette is a registered social worker, of course. She's registered with the Alberta College of Social Workers. She's also earned her master's degree in social work from the University of Calgary. And she's currently working towards her equine assisted therapy certification, which sounds really cool. And unfortunately, it's probably we won't have time to talk about too much today. But that one sounds like a fun one. So anyway, thank you both for joining us today. We're really lucky to have you. And with that, it's probably a good idea that we jump right in because we only have so much time for this session. So obviously the topic today is going to be living with kidney disease, but specifically focusing on some of the financial difficulties that people face along their journey. So I wonder if maybe we can just start by defining that problem, and I'll turn it over to you two to maybe talk a bit about some of those financial difficulties that people face.
Thanks, Joe. So yeah, we see a lot of patients that have to perhaps stop working or work modified hours when they have kidney disease and as their disease progresses and when they may start on dialysis. And often a disability income is much less than a working income. It can be 50% or sometimes even less of your working income. So patients not only have to adjust to a lower income, there may be increased cost to their health care. If they're the main breadwinner in their family, this can lead to stress and sometimes even anxiety and depression, which may make it even harder to manage day-to-day responsibilities and stay on top of finances. Sometimes there's unexpected cost of medication when first diagnosed. Some patients have never had to take medication or don't have a medication plan. If they don't have medication coverage through a provincial disability plan or through an employer, there may be a cost or deductible to a private plan or a provincial plan. Many people on a fixed income are experiencing cost of living increases these days. I mean, all of us are. Increases in costs for things like groceries and rent, like basic necessities. And there may be added costs associated with following a kidney diet or any specialized diet if you're having to change what you usually buy. And then if you do need to start on dialysis, there, or even when you're coming to clinics, there will be travel costs to the hospital or to the clinics. For example, there may not be a dialysis unit close to your home, or if there is, there may be a waiting list for that unit. And if you can't do a home dialysis or you choose not to, there will be travel costs and parking costs associated with those trips. If you're on a provincial disability plan, sometimes these costs may be covered for you, but if you're working or senior or on the CPP disability program, those costs are not. And for example, a return ride to the hospital in our area from some of our regions could be $75 for that return ride. And that certainly adds up for a month of trips to dialysis. So.
Yeah, I'd say 3 times a week, $75.
Yeah.
Yeah,
That's significant. Yeah.
Almost $1,000 a month.
That's right.
And I would just maybe add that for some people who are able to go back to work, sometimes they can't go back to work because of the nature of their work. Some folks, I know we've had some patients that work in more remote communities, and those dialysis centers have a tendency to have fewer beds, so they're not able to be accommodated. So that's a barrier to returning to work. And then another point about the financial considerations is that it's not just our patients who impact these, who experience these financial implications. Very often the families that support these patients or the patients will experience some considerations as well too. So there's a ripple effect that I think often gets lost in the discussions, but is very much important to consider.
That's a really good addition. Certainly I think anybody who is living with kidney disease and has a family can speak to the fact that it sort of affects the entire family unit. Even if it's not the main breadwinner in the family, that's the one that's afflicted, it still it takes its toll on everyone. So much time in terms of care and getting to and from appointments. So just to summarize, you guys, it sounded like people having to stop work was a big one. I know in my own personal experience, I did stop working both times when my native kidneys failed. And that was just certainly a big shock. The second time around, I was self-employed. I didn't have a company benefit package at that time. And even just leading up to the kidney failure, there were a number of symptoms, either from my other underlying condition or just the feelings of fatigue as some of those toxins and things build up in the blood as the kidneys are beginning to fail. And certainly, so, you're slowing down maybe with your work, you've tapered back a few hours, maybe you've used up all your sick time, and that now all of a sudden you're in the hospital and quickly transitioning to 3 days a week in center hemodialysis, which pretty much soaks up most of your days, and you feel awful for the first few months. And it's a lot. You suddenly have got, maybe a few $100s in medication expenses every month that I wasn't budgeting for. Parking in downtown Toronto is like $12 even after the discount. So that's like another $150 a month.
Yeah.
So yeah, I can definitely say from personal experience, there's a lot of unexpected costs that suddenly come up, and you're also probably been cutting back on your work hours. So yeah, it's a very challenging time, especially with the diet and everything too. I mean, you've got to relearn how to live with all your new things. Just take a moment at this time to remind everyone that you can throw your questions and answers into the Q&A tab. And then I'll maybe take a second to see if there's any questions here and there, sort of as we go through the different topics that we're going to discuss today. But yeah, just a reminder, if anything we're saying now sparks some interest or you want a little more detail on that, please throw it in and we'll take time to answer questions as we go along. So we've talked about sort of what the problem is and many of the factors that can bring us into financial distress as kidney patients. So maybe we can talk a little bit about what advice you might give to some patients that are experiencing some of those difficulties.
So, go ahead.
Sorry, Corinne.
Go ahead.
I was just going to comment that we always recommend that whenever possible, please reach out to either your renal or kidney social worker There's usually one attached to most clinics or dialysis units. Sometimes there are programs that you may not be, that you may be able to qualify for, but you aren't aware of. And in my experience, it's usually much easier to tap into these programs at the front end of the process rather than putting out an expense out of pocket and then trying to be reimbursed for it after the fact. That's usually a much more cumbersome process. So it's really, whenever possible, please reach out to us as soon as possible. And if there's any sort of assistance that we can provide direction in, we certainly will. Another recommendation is to please don't wait until things get worse and feel a bit more unmanageable or out of control. Recently, I had a call from a patient's family member and around some financial considerations, and we explored what available options might be. And one of the options was the disability tax credit certificate. And when a chart review was completed, this had been discussed and the paperwork had been provided a number of years ago, but wasn't completed. So there were gaps in what this individual may have been able to receive regarding some finances. And as a result of those gaps, some burdens. So just again, really reinforcing that to reach out, please, as soon as possible in the event that we are able to provide some support or assistance.
Yeah, I'm just going to give another couple examples. We had a patient one time who actually stopped taking their medications for transplant because they had a change in their employment status and loss of private medication coverage, and they figured they wouldn't be able to afford the medication. So if they had asked for help from their team before doing this, there may have been a solution that could have been worked out, and the patient could have kept their transplant instead of having to come back to dialysis. It's pretty devastating for everyone. And we also had another time we had a patient who was so embarrassed about not being able to take care of their housework that they let things go to the point where the neighbors started complaining about the smell in the apartment. And, you know, there was a lot of work that had to be done to sort of backtrack from that and help support the patient. So there's all different kinds of ways that we can get ourselves into some hot water, you know, when we don't ask.
That's true. I could definitely see how, you know, especially adjusting and not feeling very well and coming home and sleeping after dialysis and maybe not having the energy to take care of all the household chores.
For sure.
Especially if you're living alone, which sounds like maybe that patient may have been. But yeah, that's a real shame about your other patient. What a tragedy to, you know, have lost a transplant due to just financial considerations. You know, sometimes living in Canada, it's oftentimes we have a lot of support, and you know, maybe we don't hear those stories as often. You hear all the time about in the States people having to choose between their finances and their health, and that's a real shame that this patient kind of just didn't have the medication support that they needed.
And they may have if they had reached out, you know, sooner to their team. Right. There could have been some you know, a couple different solutions to that problem, but I guess they just felt so overwhelmed and that things were changing that they didn't think to do that. So that's why we encourage people to reach out, because we, you know, that's pretty, as you say, a pretty devastating effect from finances. Yeah.
Very tragic. That's you know, that's I guess the moral, as you said, being don't wait to reach out. You know, whatever it is you're experiencing, reach out, because you never know if there's a solution that you just hadn't heard of.
For sure.
I know with myself, when I first or second time around when I was starting to deal with kidney disease, you had mentioned the disability tax credit, and I had looked that up and downloaded the paperwork, and I'd gone into the clinic and I'm asked to get the nurse practitioner on the shift to fill it out for me, and she had filled it out in a way that I didn't get enough hours listed there in order to qualify, and I was surprised by that. And I thought, well, you know, maybe in-center hemodialysis patients don't qualify. Maybe they're just, the number of hours is like set just below the mark, just so that we don't kind of make the cut. And so I thought about it, and it was actually one of the things that led me to reach out to my social work team at the time, as well as the Kidney Foundation. Actually, that was my first reason to call to the Kidney Foundation. I thought, well, hey, if anybody knows, you know, whether these patients qualify, surely that they would know. And all that's brought me here, so that's great. But yeah, I was able to talk to my social worker and fill out the forms, and she took a look at that and said, no, absolutely, you should qualify for this. And they were able to coordinate with the
Yeah.
healthcare team and make sure that that documentation was filled out in a way that would ensure that it would be approved.
Right.
And it's been a very wonderful program, as well as it helps you qualify for the RDSP as well. So
Right.
that's
Yeah, then, and we'll probably get into that in the next question when we talk about our role, but sometimes we have some tips and tricks, and, you know, we've been around enough to know how to fill out some paperwork. We've heard people going to private agencies to help them get them filled out, and they charge them money, and they take, you know, some that the patient should be having. And it's not just for disability tax credits, for disability papers, etc. So if you have, you know, everyone is going to have access to a social worker in their program, and they will be able to help you, and they won't be charging you to fill out that paperwork.
Yeah, and I would just add that just recently, I actually had this experience with this process of a disability tax credit certificate, and the nephrologist had completed the paperwork, but didn't indicate that the patient met the criteria based on the number of hours. So again, because we were involved, I was able to send that back to the nephrologist and ask for the document to be edited and provide the criteria for those number of hours, so that the doctor was sure to be able to include all relevant hours in order for the patient to be able to qualify for the benefit.
Mm-hmm. Yeah, a couple of years ago, they changed the form so it looked like patients weren't going to be able to qualify, and we got the Kidney Foundation on board at that point. They're obviously great advocates for patients, and you know, we were going to take it to a different level, but then we sort of sorted out that issue and the solution to that. I think if patients only do a couple times a week hemodialysis, they don't qualify, but most other patients would. So yeah, to thank the Kidney Foundation for their support and that at that time as well.
That's great. Well, like you said, maybe we're getting a little ahead of ourselves, but on to the next topic. It's a great segue. So we can expand now on what exactly a renal social worker is, and what do they do as part of the treatment team.
So yeah, your renal social worker is part of the multidisciplinary team that you have access to. So how programs work across Canada, we have nephrologists, of course, nurses, dietitians, pharmacists, and social work that everybody has access to, whether they're, well, I shouldn't say everybody, but most people in the kidney care clinics, and then when you're on dialysis of any kind, and I think in transplant as well, you have access to people. But we're all important to your overall health, but basically the patient and you are the driver of that team, and you play an instrumental role in directing, you know, how you want your treatment to go. We're there to provide information and education and support, but how we say it in Ontario is, you know, you direct what your goals are. We address the goals of care with you, and then we can kind of help, you know, with whatever resources are available to us. So we can be a guide along your journey, but it is your journey. One of the things we talk about is social determinants of health, and these are important to consider when we're talking about how people manage. And social determinants are things like income, safe housing, transportation, access to nutritious foods, access to quality healthcare. There are many. But, you know, we've talked about some of these already, but, you know, for example, when your income goes down and you can't pay for your medications or your specialized food, perhaps, then your health suffers, right? If you can't get to your treatment, your health is going to suffer. If you can't afford to pay for your rent and your utilities and your food, then your health is going to suffer. So these days, paying your rent or related housing costs, you know, utilities and phone and internet, it may take 80 to 90% of your income, which doesn't leave a lot left over for groceries or medications. I have a patient who is sacrificing groceries right now because they don't want to get behind in their rent or utilities. You know, so there are, again, some programs that we can maybe access for support for those things, but that's a real thing these days. And sometimes there's not always a solution to these problems. The disability income is not always sufficient to sustain you and your family in the same lifestyle as when you were working, and it's an income problem. We saw this during COVID when people were making sort of more what they considered a living wage, and then they didn't feel they had to work, which caused more other problems. That's a discussion for another day. So we're hoping to see some increases in provincial disability pensions in future to kind of bring people back up to that living wage. But yeah, I mean, to sacrifice groceries to pay housing and utility costs, this is what a lot of people are doing right now, is juggling those bills. So, you know, your social worker may know about community resources available to you. So food box programs, food banks, which in our area is more like a community center, utility rebates, kidney foundation funds, subsidized housing and rent supplements and tax credits that we talked about. You know, we can't be more specific about some of these resources because they're different across the country, but we would encourage you to reach out to your social worker for a consult. And if you don't know who your social worker is, then you can reach out to your nurse or your doctor, and they can certainly connect you. And yeah, go ahead, Nana.
Yeah, and just to piggyback on your comment earlier, Corinne, about the importance of the patient being instrumental in the team. I think sometimes there's a tendency, because these programs can be quite cumbersome to navigate, that oftentimes there's a tendency for patients to want to defer to us as social workers to navigate for them. And perhaps there's a feeling of resistance from myself around encouraging that I will support you in navigating these programs. And it's really purposeful when we do that, because recently I had an experience where, again, provided the patient with support around navigating a difficult program, but in the end, the patient was successful. And in doing that, having that experience, it's very empowering for the patient. And next time that there's a question or concern or consideration, the patient is able to independently do that follow-up on their own and no longer necessarily requires the same level of support. Again, just promoting that independence.
Mute myself. That's great. So I'm definitely hearing how your entire living situation can sort of weigh in on your overall health. And so when the financial burden begins to trickle through every aspect of your living situation, not just your medications, not just your lifestyle, but your living conditions, your diet, your everything, it all kind of is wrapped together and it all weighs on you one way or another. If your financial burden can hold you back just as much as not getting your medication or not getting your treatment. Sounds like would be the case. Yeah. And I'm sure we talk about mental health among patients a lot as well, and deterioration in your quality of lifestyle or deterioration in your living arrangement would obviously also, I'm sure, take its toll on the way you feel on any given day.
Yeah, I mean, we talk about there's grief associated with loss of health, possibly loss of you know, your sense of self-esteem if you're not able to work or be that breadwinner. And then all of these things can lead to, you know, certainly anxiety that we all sort of felt during COVID and isolation, and then if that continues, some, you know, maybe even depression and worse things. So again, early intervention is really critical.
That's great advice. I see that a few questions have come in, so it might be a great time to take a break and take a look at a couple of these before we move on to dive deeper into the topics. The first one we have, I'll read out for you. I'm just beginning my kidney journey. I have a nephrectomy scheduled in 2 weeks from today. I don't know what the future is at the moment. I'm scheduled to see a nephrologist in June. Is there anything I should do now?
Well, I would suggest, yeah, you're doing one of the right things is by jumping onto this patient forum and meeting other people, and hopefully you're going to attend some other sessions and realize how positive people can be once they're connected for some peer support and learning about your illness. What a lot of people do when they go and see the doctor, they start carrying a binder with them so that they can keep track of their blood work, start writing down some questions that you might have. And if you're on the Kidney Foundation website, the handbooks, the kidney manuals are really important. So the one that you would want to maybe look into right now is living with reduced kidney function.
And I would just add that to ask your, like when you have your appointment with your nephrologist, to ask whatever questions come to mind. All questions are good questions. And in my experience, the nephrologists are really good. If they aren't the person to answer those questions, they will put you in touch with the appropriate people. So bring all questions forward. The nephrologist will direct you to the right place, and hopefully you'll be able, if there's any outstanding questions, those that information will be provided.
And I would also suggest that you bring a support person along with you to your appointment, because sometimes if you're nervous, you know, you may forget some of those questions or not be able to retain all the information. And it's just good if you have family members or friends or loved ones that, you know, they're concerned about you as well. It's important that they understand what's going on with you, and then it can help support you through that.
Yeah, that's good advice. The next one we have, actually, now that I read it, it's kind of more of a comment, but and it's TELUS has a discount for computers and internet called Internet for Good for BC and Alberta. If you are low income or AISH, I think it's pronounced AISH, is that if you're on the Alberta provincial support. I'm not sure if you guys have heard of that program, perhaps.
I don't
No,
know if, yeah, I'm sure Nanette has, but
yeah, more likely she's
Yeah,
from.
surprisingly enough, it doesn't come up all that often. In my experience, I find patients to be really sometimes more knowledgeable than myself about the resources that are available. So that one actually hasn't come up all that much, but it's great to put it out there, because just because it doesn't come up doesn't mean that people don't know about it. So the more we talk about these things, let's talk to each other, talk to your support team. We can better support each other.
yeah, and we found out about there's a Rogers Connected for Success program as well that's very similar, that has rebates or reduced rates for internet and phone. They have different bundles, but it's only available in certain provinces, and maybe that's why, because there are other things available in other provinces. But again, we find a lot of word of mouth, like patients hear about programs and approach us about certain things if they've heard from other patients that they may be eligible for something, or they've heard about something but we didn't approach them first, and then they're hearing about it from another patient in the waiting room or on dialysis. So it's great, you know, that they would hear about these things, and they're very resourceful, right? So, and it helps us to learn about them as well.
Right. Okay, well, that's it for the questions for now. So we can move on to the next topic. But yeah, just a reminder, that's great. Anyone still listening, still watching, feel free to keep throwing those questions out there, and we'll cover them as we go. And we'll have time as well at the end to cover additional questions. Okay, so we talked again about the problem. We've talked about some things that can be done, how the social worker fits into the entire team. So moving on, I think I'd like to ask you, why is it that you think some people don't reach out for help when they need it? Certainly, I think we've all kind of been there, maybe been too proud or too stubborn or whatever the reason is. But can you talk a little bit about that?
Yeah, for sure. It's not uncommon to feel like people can manage on their own, or that they perhaps don't need help, or maybe that they really want to be able to manage on their own because they're used to doing that. Maybe they've always been able to do that independently, or they've always been the helpers and they're not necessarily comfortable asking for help for themselves. So there could be a myriad of different possibilities. There could be stigma attached to asking for help, and the pride that you talked about, and also some cultural considerations around seeking help for things like finances. And as we've talked about earlier, sometimes people don't realize that there is a support program out there for whatever the need is. Or maybe they tried in the past and haven't had much success, and so don't really feel discouraged about doing that again. And again, we've talked about how those systems aren't always easy to navigate and can be cumbersome. And we also recognize that some individuals maybe have not had a positive relationship with the healthcare systems or the role of social work in the past, which can be a barrier to accessing services in the present or the future. And so our hope would always be that we can build relationships that help to foster connection and trust in the renal team.
Yeah. And I say we're trying to, I think through this webinar and just, through services and realizing everybody has access, to normalize the need for help. Everyone may be in a situation at some time in their life to need help. And, when you are in the position that you can help others and you pay it forward. We have a patient right now who was offered help for utilities in arrears and refused initially, and wanting to tough it out on their own, as Nanette said. And their mom reminded them that they have given to various charities over the years with the expectation that the funds went to people who needed a helping hand at the time. And at this time, the patient was the one who needed the help, and that there shouldn't be a shame in that. So this sentiment helped them realize it was okay to ask for help, and they called me back and said, okay, let's go for it. And we were actually able, through a program in Ontario, access him some help for these utilities and arrears, which just sort of helped, that ripple effect helped, this person be able to pay for some other bills. So I think acknowledging that there's an income problem in this country, as I said, in the world, disability income, no matter how creatively you juggle the bills or how you break it down, may not be enough to live on and pay all your expenses. So it's nothing you're doing wrong, and it's not personal. It's a political or a system problem.
Definitely. I think that's a really wonderful story. It's sort of a very good what goes around comes around story. And it's so nice that, this patient or the family member was able to remind them, hey, you've done a lot of good, it's your turn to receive a little bit of benefit, a little bit of help. We all have those days, we all have those times.
For sure.
So that's awesome. And then that patient was able to come and did come around and get the help that they needed. Wonderful. I certainly can think that there's definitely lots of times where I've sort of felt the same way, when like I mentioned, when I was self-employed when my kidneys failed for the second time, and it was very acute, very fast. And so at that time, I did a transition over to a provincial disability program for a while because I didn't have a long-term disability plan through work or anything like that because I was working for myself. So I can definitely relate to that sort of feeling of the stigma that kind of comes with that. It's like, you feel like, you're not contributing enough, or, kind of joking with your friends or whatever. And it's challenging. But I think that's why, getting together and having discussions like this is really important to sort of dispel some of that stigma, dispel some of that, the shame that might come along with those feelings. We have another question that just came in, so it's probably a great time to do this one. A little bit long one, bear with me here. I'm 30 years old and my 64-year-old mom has kidney failure. She goes to get her hemodialysis treatment 3 times a week, about half an hour drive from where we live. I just quit my job to be her full-time caretaker since I live with my mom. I was feeling very overwhelmed at work and realized my mom needed me more than I thought. There is a family caregiver benefit for situations like mine, isn't there?
Annette, you want to?
Sure. Yeah, and this sort of scenario is quite common when, in my practice anyways, where it's not uncommon for family members to be providing a tremendous or a substantial amount of care to their loved one, the one who is on dialysis, and especially the transportation costs. So the first thing that popped into my mind was the disability tax credit certificate. And that's something that we can talk about because it is more of a federal program and it applies to everyone on the call today from Canada. And with that program, if you are a caregiver for the person who's on dialysis, you can oftentimes receive that tax benefit. Whatever the patient isn't able to use for themselves, the leftovers can be applied to your taxes to provide that tax break. That's one thing that came to mind. And then with regards to the caregiver benefit, that program does require a medical to be completed by the nephrologist. So it really would be in discussion with the nephrologist, because it's the nephrologist who has to provide that clarification. And So I would encourage you to have that discussion with the nephrologist around, does this particular situation meet the criteria for that program? I know recently we just had a patient go through this, and I don't quite know the outcome yet, but I've seen how the physician completed the medical, and I'm hopeful that the patient's caregiver will qualify for that support.
Great. I like hearing all the patient stories. The examples are very helpful.
And I just want to add one other story. I kind of,
Please.
there's another patient that I've known for quite some time through the kidney clinic and now on dialysis. And this is somebody who is also very reluctant to ask or accept help, and is very compassionate towards other patients, thinking they need help more. And so what I told this person, just joking around with her, was that if they didn't ask for help, then they were jeopardizing my job, because that's what I do, is I provide this information and support to people. And they laughed. So I think I got the message across. And, you know, the next time they did call me and say, well, I don't want you to lose your job, so I'm calling you. But, you know, you can't do that with everyone. But for this person, it worked. So.
That's awesome. What a great way to sort of break the ice with that patient and get them laughing. And yeah, that's awesome. Good job. Okay, well, that clears out our questions for now. So hopefully we'll see some more come in as we go. We were just before that, we were just talking about why people don't reach out for help and why perhaps they should. But kind of carrying on from that theme, maybe we can talk about some of the potential consequences of not asking for help. So what can happen? What goes wrong if we need help and we're too stubborn to get it?
So there might be supports out there for the patient, but the treatment team doesn't know that they need it until they come forward. And then what happens is, I think Nanette alluded to this, is that the problems will continue to sort of pile up, and it could lead to a much worse problem down the road. You know, and like that patient I talked about that stopped their medication because they didn't think there was any support for that and lost their transplant. So that's, you know, a pretty devastating effect. Or they accumulate a lot of credit card debt, and there may have been a program that could have helped, you know, earlier on with that. We've had patients have to declare bankruptcy, different things like that. And also, when we were talking about the social determinants of health, I mean, you can certainly get sicker from not asking for support sooner. If you're not able to take your medications as prescribed or follow that diet, then it's going to affect your physical health and possibly your mental health as well.
Absolutely.
Yeah, and to piggyback on the mental health, how that can be impacted by these financial stressors, it reminds me of an example with a patient who shortly after starting dialysis wasn't able to return to work, simply not because there was an inability or not a desire, but again, it was one of those scenarios where the patient's employment was in smaller areas where those dialysis units are often or have few beds, and they're not able to accommodate people who are traveling, and so wasn't able to return to their work. And then the implications of that is this particular patient was used to sending money home to support other family members, and not being able to do that, not being able to continue in that role that this person had become accustomed to, proved to be very difficult for this person, maybe even more so than the adjustment to the physical illness. It was having to adjust to this feeling like they'd let their family down. And that was a really hard piece. And so just to highlight again, the mental health considerations that can come from these financial stressors. And this is just one example. Everyone is unique, and there may be other considerations too.
Great. Okay, so we've talked about the consequences, and I can certainly relate to some of these. And I think that the idea of things getting worse the longer you wait is certainly one that is good to drive home here today. And because part of that is because things take time. You know, if you are reaching out for help and your social worker has recommended a service or a program, oftentimes there's an application period, right? You need to get your documents in order. You have to submit an application. Sometimes you have to wait a couple of months, you know. I can certainly recall when applying for different benefits, CPP, the provincial benefits, even I think in Ontario, we have a Trillium drug plan. All these things take time to get done. And sometimes you have to have your taxes done. Maybe it's early in the year, you haven't done your last year's taxes yet, and these things are means tested. So the sooner you get on it, the sooner the better, because if you get the advice that you need, you get the paperwork in, hopefully you don't have to wait as long, and you get some of the help before you truly need it. Because if you have to come out of pocket for your medications for a number of months before your benefits kick in, or before these other benefits kick in, you can really dig a deep hole. While you know, especially if you're having to turn to credit cards and carrying those balances at high interest rates while you're juggling all these other things, and then it takes the stress toll, you know, adds up in many other ways. I do see a couple more questions have come in, which is great. So
I just want to add one point to that. Joe. I think that's, we often have patients who haven't done their taxes for many years, actually. So it's not just this, and you're right, Trillium or even, you know, disability tax credit, you need to have done your taxes. But, you know, I remember a patient one time who hadn't seen a doctor in many years, wanted to get him onto the provincial disability program, but didn't have a health card. And you know, had or lost it many years ago and didn't have a birth certificate. So we had to keep going back and doing but firsts, right? Like we had to get that first, and then we had to apply for that, and then we had to do this. So you're right, there's many steps sometimes, and it takes time. So
yeah, the tax one is a good one. And for people who may be listening and thinking like, why wouldn't you have your taxes done? For a lot of patients, especially if they're taking advantage of provincial disability programs, a lot of that income is tax-free. And even if you're on CPP, that income tends to be below the minimum threshold. So for a lot of patients, they don't owe anything every year. And so there's not much incentive to fill it out. Like maybe they don't care to get the HST checks or whatever, so they don't bother. And so then if it goes a long time and then suddenly you might need to prove that, hey, your income was actually that low, now all of a sudden you have all these years to catch up on, and it can become quite a time lag.
Oh, that's a good point. But there also are there's sometimes costs to getting your taxes done. So what Revenue Canada does is post a list of tax clinics in different regions that have people who will help you prepare your taxes if your income's below a certain amount, and they don't charge. They use volunteers for that. So that's another reason to, you know, if you're not online, to reach out to your social worker if that's the case. And sometimes in our area, for example, Salvation Army used to do that throughout the year, you know, not just during tax time. So there are some resources that people can access.
Great. Yes, I've actually heard of some. I know a friend that makes use of a local free tax clinic in my hometown.
For sure.
All right, we'll try a few of the questions. Then to the questions. Do you have any advice for patients and or their families who feel like they have things under control and do not want to reach out to their renal social worker?
Go ahead, Nanette.
The first thing that popped into my mind when I heard that question is, if you're comfortable talking to your family physician, that's definitely something that you could explore. I can't remember how the question was worded exactly, if it's just uncomfortable talking to the renal social worker. If that's the case, then any member of the treatment team, whether it's the nephrologist, maybe the bedside nurse who the person has a relationship with, maybe it's the dietitian, or perhaps some programs have other allied health team members, like a kinesiologist. Whoever you are most comfortable talking to, that's fine. It doesn't necessarily have to be the renal social worker. Sometimes if there is, in that scenario, if somebody doesn't want to work with me directly, I can work behind the scenes and still be providing that direction and support without having that direct contact. Or if there's another social worker in the community, we can be working collaboratively. Again, I can be behind the scenes. I don't have to be providing that direct support if that's a barrier to accessing services.
Sometimes it's a matter of people don't know what social workers do on the team. I mean, a lot of patients like that in the kidney clinic, I think we mentioned earlier, some patients have had bad experiences with social workers, whether it's through another agency like Children's Aid, for example. So sometimes it's just introducing our role and what we can do to support, and mentioning some of those programs. Like I always try and mention to people about the tax tips that the Kidney Foundation provides us, so they can claim mileage to medical appointments if they're over a certain number of kilometers, about the disability tax credit if they're on dialysis. We do a lot of advanced care planning with our patients, and just, you know, giving them a brochure about what our services are. And if you know, not everybody needs to access social work, that's okay too. But if there are things that they may not be aware of that we know about, then we're happy to provide that information. So
Definitely. And if I could throw in a little something there, I would say also look to reach out to programs with the Kidney Foundation. You know, they maintain a lot of resources on their website to point you in various directions. And then if I could also say peer support, they run a number of peer support programs where you can connect with other patients and ask them what they did, what worked for them. Patients in your own region as well that might have insider tips to living with kidney disease in that geographical location. So yeah, it's been a wonderful benefit to me, and I find just connecting with other patients to be very fun and enjoyable, and happiness is therapeutic. So it's a good way to go.
yeah.
Then the next question, and this one's kind of a complicated one. So I'll just remind you guys, we've only got about 10 minutes before we have to get to our closing remarks, and we still have at least one more topic we were hoping to cover. This one is, can we address some of the health literacy and racism issues preventing people from seeking help? I wonder if you guys can speak to that a little bit.
Nanette, you had some good things you were thinking about there.
Previously, I had commented on acknowledging that there may be individuals who haven't had good past relationships with the healthcare system or social workers. We recognize that, and it can take time to build those relationships. So that's always my hope, is that we can work towards establishing those relationships in order to be able to provide the best service possible. And I would much prefer if somebody comes to me and says, whatever the issue is, I'm having trouble having this reaching out because of A, B, C, and D, and let's just talk about it. That's how I prefer to work. I don't know if that answers the question, but we can acknowledge the past and what do we need to do to meet your needs right now in the moment.
And sometimes there are other services or individuals we can link to. In our hospital, for example, we have an Indigenous patient navigator. So for our Indigenous patients, we do ask them if they would like to be linked with this person, and sometimes we can visit them together if there are some barriers or some trauma coming into the hospital right from the beginning of their coming to us. And just try and work together, or to refer to some community services. And as I said, not everybody has to link with social work either. I mean, I think we have a huge caseloads and we're not doing a lot of individual therapy with our patients, I would say, generally. And so I think if people are looking more for therapeutic resources, we would often refer out to the community or family health teams, and we're more resources for helping coping with that chronic illness, and certain resources that we are directly related to dialysis and paperwork for disability tax credits and disability pensions, things like that. Sometimes certainly we are called for crisis things, but I would say a lot of the individual counseling we're referring out for that.
Very good.
And I would just quickly add that this has come up for me in the past, and it does sometimes take, I'm just trying to think how best to word this, is that sometimes as a team, we have to really be willing to take a look about how we do provide the provision of services. And is there anything that we can do to change that so that it is more sensitive to some of these questions or concerns? So I think that there's always, or I hope that there's always benefit in bringing these things forward, and that there's a willingness on the other end, like my end, for example, to really hear what the person is saying and try as best as possible to be able to accommodate.
Yeah. And I would say too, the social worker is probably your best advocate. We're the only ones in the program that are not medical, really. And so we're talking to you more in your language, and as Nanette says, hopefully we can, address the problem or facilitate or bring it forward in a non-medical way that we can help address with the team if there's an issue.
And with the health literacy piece, I don't know if this is what was meant by the comment, but I have witnessed and observed, the provision of treatment services to patients, and it's all very like for the nursing staff, it's what they do. It's what they do day in and day out, and they're just used to it, and it's no big deal. But from my perspective, where it is a big deal, and from perhaps a new patient's perspective, where it's a very big deal, it allows us to, when those concerns are brought forward, it allows us to have those discussions as a team about how to look at things from the patient's perspective, that we always need to be mindful of that. And if a treatment is being provided that's maybe different from the norm, take the time to stop and explain, make sure there's no questions, rather than it just being from the nursing perspective, well, this is just what we do.
Mm-hmm.
Great. And, these are two very deep topics in terms of health literacy and equality in health. So I know we only just scratched the surface of it here today, but just a reminder, we do have a big networking session at the end of things today, and that would be a great topic to openly discuss among a wide group of people, I think. But we do have to move on to the next topic, and I just see we have another question come in as well. I might hold the question just a bit, just so we can get through our last topic, and then if we have time, we'll get to the question. And so the last topic was just a reminder. We were talking about seeking help and some of the consequences that come with not seeking help. And so one of the other questions we were looking to cover was, how do we address that stigma? We talked about the stigma and identified the stigma. How do we address that stigma that comes with asking for help and suffering these sort of financial disabilities?
Yeah. So, okay, go ahead, Nana.
It's okay. If you want to go ahead, that's fine.
I can do part of it, but I think we talked about a lot of these things already, is that normalizing that everyone faces financial challenges at some point in their lives, and maybe not everyone, but a lot of people do. And coming forward for support, for finances is really no different than reaching out to your doctor about a medical issue. For example, our food bank offers social prescriptions here, and I'm actually going to do a tour of the food bank with my colleagues today to find out exactly how that works. But basically it's, food is a really just as important sometimes as your medications. And so if the doctor can provide this prescription for you to go to the food bank, trying to remove that stigma of having to ask for some help that way. And then, all those other social determinants of health that we talked about, when your income does not align with your expenses, your health can suffer in many ways. Yeah.
Definitely.
Yeah.
Did you go ahead?
Oh, I would just add that. And I know we often feel like we're alone in the position that we find ourselves in, which can make asking for help even more difficult. To trust that you're not alone, to trust that we get calls every day about these things, to trust that you are entitled to this support. And I know it can be there can be some moral distress around. I'm not comfortable asking for help. I'm the helper, not the one who needs help. And I know that can put somebody in a difficult situation. So even let's talk about that. Let's talk about, what you might be uncomfortable with. And just again, to reinforce that if you're eligible for these things, I'm all about, if it's something that's available to you, then let's get it for you. Whether you may feel like you need it in this moment, because you may need it down the road. And it's better if we can do it on the front end, because like Joe and Corinne had talked about in the past, is sometimes this stuff can take time. So before we get into a crisis, let's talk about it now.
Yes. Yeah, it's important to break down that stigma barrier. I've known lots of people that have gotten themselves into trouble with that. I can tell a quick story about a friend. He was near retirement when COVID hit, and then when the COVID support program came out and the government was giving away that extra income support, he was self-employed. His business was very focused on supporting IT networks in office buildings, which obviously many of them shut down and closed the doors because everyone was working from home, and there was a big slowdown there, and so very little work for him. He had a sort of a pride point for him was that he had never needed to take any type of any type of assistance, and he had worked his whole life and all of that good thing, which is great, except for so he didn't want to take advantage of the COVID program, and so the whole thing lagged on a lot longer than he thought, and he dipped into his investments and his savings, and now his retirement savings have taken like a very large chunk out of that, and sort of looking back, he's like, well, maybe I should have taken part in that program. That was there to help replace the income loss from this unexpected event, and it wasn't really like his fault, that COVID had come around and changed the way the world works. So I definitely think that that's a really good message to send back. We have 2 minutes. I think we can probably address this question really quick before kind of getting into some of the closing remarks and wrapping everything up. This one is, what criteria is used for referral to renal clinic? Is it EGFR rate of filtration rate decline, these kinds of things? We've certainly seen this question a lot in peer support groups, and maybe I'll let you two take it away. I think it varies by province as well. Each province has different criteria for when they would refer you on to a nephrologist and how they run those.
In Ontario, I believe you're eligible. You may be seeing a nephrologist. You're eligible to come to the multi-care kidney clinic with that multidisciplinary team when your kidney function or your EGFR is at 30% and or your kidney filtration rate is 10%. I believe those are the numbers. Correct me if I'm wrong. But we also have a dietitian in Ontario who well, actually, I think she does this Canada-wide, is willing to work with patients privately who's don't qualify for that clinic but want more information about their diet. So there are some other services out there as well. Nanette, I don't know what it's like in Alberta.
So what I would just mention is that for patients, and I'm not part of the pre-care team, but this is just my observation, is that some of the nephrologists are connected to a multidisciplinary team and some are not. Mm-hmm. So there's differences based on nephrologists. My experience is dialysis related. And so when patients come onto dialysis, they have access to the whole team, regardless of who their nephrologist is.
Right. Right. Yeah, and I think people don't start dialysis till their kidney function in Ontario is below 10, like 8 or 9 or so. Those are the percentages that we work with. But again, it might be different across Canada. So.
Yeah, I think it is. There's a lot of variation there. So for those who are maybe outside of the two provinces we kind of briefly discussed, talk to your GP about what referrals might be available. And if that doesn't yield a lot of results, maybe call to the nearest hospital in the biggest city in your province, ask them for their renal team or ask them for the dialysis clinic, chat with a nurse or someone who can maybe just give you some idea of where you're at and maybe what you need to do to get that referral.
Or reach out to the Kidney Foundation, right? They often are able to connect you with the right people. Yeah,
definitely. Yeah, your local Kidney Foundation branch would be an excellent resource for that as well. Okay. I think we're coming near the end of our time, so it'll be good if we wrap things up. We've heard about how stressful it is to live with financial burden and how it takes a toll on every aspect of your life, including your health. And so I wonder if we could just kind of wrap things up by saying, what would you tell someone who's currently living with kidney disease about how to handle that stress? How do we make it better?
So one message that I would hope to leave everyone with today is just to come talk to us. Come talk to us if you feel comfortable to do so, or talk to whomever you feel most comfortable doing so. Sometimes there aren't easy answers, but at least we can have an open discussion about what may or may not be available to you. Use your formal and informal supports. There's been lots of discussion here today about the peer support program through the Kidney Foundation. People have been really isolated the last few years due to COVID. So connection is so incredibly important. So connect to the people again for your mental health. And it's important to know that you're not alone. One thing that we often say is that it's okay not to be okay. Things are not easy right now. The world is still coming out of COVID, the tridemic, and everyone is still dealing with this ongoing uncertainty about what might come next. So when faced with such uncertainty, it's important to focus on the things that are within our control and not on the things that are outside of our control. There's a nice quote by Viktor Frankl, who's a psychiatrist, author, and Holocaust survivor, who says, when we are no longer able to change a situation, we are challenged to change ourselves. Another piece that I would just like to put out there and mention is the importance of self-care. Self-care is really important when we're trying to manage difficult or stressful times. We can develop a self-care plan that's tailored to our specific needs. Sometimes people can feel like self-care is selfish, but it's really not. It can look like a lot of different things. Self-care can be asking for help. It can be spending time alone. It can be putting yourself first, asking for what you need, setting boundaries, staying at home, saying no, forgiving yourself, or taking a step back. Again, another quote that I'll just close with is Deepak Chopra, who's an author and alternative medicine advocate, writes, "For everyone, well-being is a journey. The secret is committing to that journey and taking those first steps with hope and belief in yourself."
It's a great closing quote. And with that, I think I can safely turn it over to Daisy to close out our session for today. Well, this session. Don't worry, there's lots more to come.
Thanks, Joe. And thanks everyone for joining our session today. We've come to the end of the session. I would like to thank Corinne, Nanette, and Joe once again for taking the time to be with us here today. We now invite you to please join our next session, Traveling While on a Kidney Journey, at 1:30 p.m. We hope to see you there.